This video shows a child with very important clinical finding, that is lump seen on the lower back. There is also erythematous rash on this lump area. We broadly classified these spine pathologies into spina bifida occulta and spina bifida aperta if the spinal cord is the spine is involved. In spina bifida occulta, the skin of the overlying lesion will be normal. There can be tuft of hair, abnormal rash, or some rudimentary skin appendages, but the skin of overlying area will be totally normal, like that's seen in the index case. While in this cases of spina bifida aperta, the skin will be affected, like in case of meningomyelocele, like in case of myeloschisis, the overlying skin will be not normal. So it is basically a case of spina bifida occulta. Next, we have to see that what it can be the underlying cause. So underlying cause can be meningocele, can be lipomeningocele, and can be local other pathologies. For that, we need MRE brain. While looking all these type of spinal pathologies, we have to look for associated finding, like in the foot, there can be foot in pes planus, there can be club foot, there can be weakness of entire leg, the both legs cannot move. There can be the abnormalities of the hip joint in the form of hip joint dislocation. There can be the bladder and bowel involvement in the form of atonic or hyperactive bladder and the patulous anus. There will be constipation and fecal impaction. Patient can have involvement of the heart in the form of congenital heart disease, or even can have the hydrocephalus. And in some cases, patient can have the renal pathologies because of the continuous neurogenic bladder. There is also important finding which is called as latex allergy, that is seen in case of spinal pathologies. So our index case, if this video you are seeing the foot of this child, though there were club foot, so patient had bilateral club foot. The reason of club foot is because the muscle that involved here are two type of muscle, those which are causing the plantar flexion, and those which are called the dorsiflexion. So if only the muscle of dorsiflexion are involved and plantar flexion muscle are totally normal, the patient will have the club foot abnormality as seen here. So this is the MRE, the index case. This is MRE spine taken in the sagittal view, and the important findings here is localized to the lumbosacral region. So if you closely see this MRE, these are basically the T1. These are the T1 section, while this one is the T2 section. The reason is because the CSF here is appear to be white, surrounding the card. So let's move towards the T1 section. In this T1 section, if you the basic principle of T1 section is that the fat in T1 appears to be too bright. So all those areas which contain fat will be brighter on T1. Like these areas are appear to be bright. So these are basically the fat areas. So in our index case, the child had lump on the back, and the lump on the back, and that was having normal skin. So our possibility was spina bifida occulta. In spina bifida occulta, we thought the possibility of lipomeningomyelocele. So this is the case of index case here. So this is basically having some defect in the spinal cord, and the defect is having a high fat content. Like this fat content is basically the lipomeningomyelocele. And another important thing that you can well visualize here is that the spinal class is defective here. There is gap in the spinal cord. So this is basically the pathology of the cord, that is spina bifida, and the reason is that a fat material is present here. So this is basically case of lipomeningomyelocele. So this needs again surgical intervention, and patient can have the finding of all those myelopathy finding of the lower limbs of bladder and bowel involvement that can be seen in other kind of these spina bifida occulta disorders. Thank you.